You're now listening to the Adiel Gorel Show. Each episode, I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today, on the Adiel Gorel Show.
So what happens is you have four chambers of the heart. Okay, so you got the top chambers, the bottom chambers of the heart. So the top chambers are called the atrias, and you could Google this on anything. You can be able to see the anatomy of a heart. So the top chambers are smaller.
Hi everyone, it's a joy to have you here with us, and I feel very fortunate today to have Diamond Fernandes with us. Diamond is going to tell us about some very special treatments for heart conditions, talk about a more holistic view of how to deal with heart problems. But I have a lot of sneaky questions for Diamond about using that lovely technology for many, many, many other things. Yeah. So here we are. So welcome to the show.
Thank you very much. Yeah.
So Diamond, can you tell us a little bit about your own journey and the passion that led you to the work that you do now?
Yeah, so I'm the founder and director of the Heart Fit Clinic, and so I started this in 2007. But prior to that, what happened was that my father, he actually had his first heart attack at 38 years old, and that's super young. I'm 46 now, and so something I'm always thinking, oh gosh, is it going to happen to me? And what I've learned over the years, and this is why I've got really passionate about doing what we do, is to see what's going on. So anyway, at 38 years old, he had his first heart attack. At 42 years old, he ended up with bypass surgery. And I was a young kid at the time, and he basically told me, I got a new heart and everything's okay. And so I went through school. I went into school at University of Calgary here, and then I went into working with doing elite athletes and training elite athletes and whatnot. And I was doing the VO2 max testing and all that other aspect of it. And so I was away on a ski trip, and I found out my dad ended up with another heart attack. And I'm like, this is just not a few years ago. Like, what's the difference? Like, what's going on here? And so I wanted to get a little bit more in depth with that side of things. And so it pulled me into the field of cardiac rehab. And so I got certified from the American College of Sport Medicine to do cardiac care. And so basically, to keep it layman's terms, I'm a physio for cardiac rehab people. So people who've had a heart attack or heart event, that's where my expertise was lying at that time. And so I got a job with a total cardiology group here in Calgary. And I started with them, and I got exposed to, we had a small office. It was 1,000 square feet and 18 of us were in there or something like that. And it was maybe not that much, maybe a little bit less. But the point is that I got to be mentored by some of the best cardiologists in Calgary. And, I kind of saw a gap, and I saw people coming back, and I'm like, what's going on here? Like, something's off here. There's got to be a better way. And that's just my entrepreneurial mind kind of going off on that side of things. And so I started the company, but I never really did anything about it then. And then every year I've been going for 22 years now. I've been going to the Canadian Cardiovascular Congress, and it's a conference that also housed the cardiac rehab professionals there as well. And so I got exposed to some really great stuff. And one of the doctors in Montreal at the time where the conference was, he's like, why don't you come meet me? I got a job opportunity for you. And I think I was 30 years old or 29 years old at the time. And I said, well, I'll take a look at it. And so it was a job to start a clinic in Dubai. And so I ended up going to Dubai and started a rehab clinic there. So that was in 2005 now. So from 99 to 2005, I was working at the Total Cardiology group there. And then from 2005 to 6, I was in Dubai. And then I didn't like working in Dubai as much. It's not like I'm Canadian. I'm a Western raised kind of thing. And I just found it was a little bit backwards there. And so I ended up leaving, and it was an amazing experience. And I ended up coming back to Calgary. But before that, I managed the program in Kelowna. And then I started the Heart Fit Clinic in 2007. And so we've morphed into a clinic now where, like, I've been certified at the Wazoo now. I've got advanced cardiology modules. I'm working on my fellowship right now. And so stuff that physicians are doing that I'm allowed to do because of my expertise in this field. And what's happened is that we just have the ability to go way more in depth than what gets done in the healthcare system. Why? Is because the majority of people that have heart attacks and strokes have normal cholesterol, and I'll get into that. The majority of people that have heart attacks and strokes have no blockages, so I'll get into that. And heart stents and bypass surgeries are not a cure. And so this is what the premise of our clinic is. And once I found those gaps, this is where we have clinics, all over Western Canada now to kind of help people prevent and reverse heart disease.
Fascinating, and thank you for doing what you're doing. Of course, on the show, we're going to go beyond heart, diseases, but we'll start there because you have a sign saying heart right behind you.
Yes.
So what's your definition of what heart disease is and what causes it?
So I wrote about it in my first book. So my first book is called Beating Heart Disease. I published that in 2017.
I like the name.
And play on words. And my next book is actually in the works being published, and it's called Death of the Stress Test. And so when you ask me what my definition of heart disease is, most people might think it's a plumbing problem. And these arteries are not a pipe, they're a muscle. And I say that all the time. So arteries are a muscle, not a pipe. Any doctor who tells you that these arteries, I've cleared the plumbing problem or I've cleared that issue, walk away and try and find another physician because it's wrong. And I'll talk about, what you should be doing in the event that you end up in that situation. But my definition of heart disease is quite simple. And there are three different pillars when we talk about heart disease. There's a structural component. So the heart is a muscle also on its own. It's got different chambers of the heart. It expands and contracts and pushes blood out to the whole body. So there's a structural component. There's the electrical component. So there's the electricity that times your heartbeat. And then there's the plumbing aspect of it. But arteries are not a pipe, they're a muscle. And I'll get into that in a little bit moment. But when we talk about heart disease, if I were to sum it up in one word, I would say it's inflammation. It's something that is environmental factors, whether it be smoking, to genetic factors that we can turn our genes off and on based on what we do. It's an inflammatory state that puts inflammatory cascade, whether it hurts a valve, to going into heart failure, to having an electrical imbalance, to having a plumbing problem. But ours is not a pipe, right? So anyway, that would be my simple definition of heart disease.
Okay, and so some people like to say, many doctors even say, that heart disease is completely preventable. Mm-hmm. Do you agree with that statement?
So I think it's important once you find out, especially the testing that we do in our clinic here, I think it's super important. Gosh, we've had people fly all over the world, people from Africa to a lot of places in the States come up to our clinics in Canada here because, we're really good at what we do. The artery inside the artery wall. So when we talk about heart disease, we're talking about coronary artery disease. And when we talk about reversibility of it, inside the lining of the artery wall is all skin, just like the skin outside of my body, it's all skin. And that's called the endothelium. So the endothelium can get damaged from hundreds of different things. And we'll get to those in the show here a little bit more, but hundreds of things that can damage the artery wall. Cholesterol is not one of them. But what happens is that artery disease, when it happens, when that damages the artery wall, it leaves it then susceptible for these smaller particle sizes, to these atherogenic particles, I call them. So these plaque-causing particles that are just floating in their bloodstream. They're doing it, they're just floating around, innocent bystanders, until they get used up in a negative way. They sliver into the lining of the artery wall, and then it goes through an inflammatory cascade to build up like a pimple on your face. Now, once it happens inside the artery, it's a little bit more challenging to get rid of that pimple. But if that pimple pops, that is a heart attack. And so the 90% of heart attacks, almost 90% of heart attacks will get missed with conventional cardiology testing. That sounds crazy, but because they're looking for a plumbing problem, where 90% of heart attacks occur with a blockage that a cardiologist will never pick up. And that's where we come into play. We're trying to find the inflammatory cascade to the artery wall. So can artery disease be reversed? Yes. It's about doing two things though. One, actually three things. It's about changing the inflammatory state to the artery wall. Many ways that we can do that, and I'm sure you'll ask me that in a moment. Two, it's about changing the lipid-rich necrotic core. Use the big word, so I'll explain it. It's basically the consistency of that pimple inside the lining of the artery wall. And three, it's about strengthening the skin over that pimple so it never pops. Right? I don't have a pimple today. I think I got a perfect blemish skin today. But anyway, normally I have one to show you guys. But anyway, the point I'm trying to make is that it's reversible once you understand the deficiencies that someone's presented with, because not everybody has heart disease for the same reason.
Okay, so I mean, in the attempt to prevent heart, disease, what would you say is the heavier move, diet or exercise, or are they, about, the same?
So I think they're both important for sure. If you were to ask me to pick one, we always got to eat, right? So we always need energy. Very rarely can we go days without food. So if you were to ask me one of them, I would say definitely nutrition becomes more important because we're having X meals a day. We're eating all the time. Exercise becomes very important to reduce the inflammatory state to the artery wall. But when we talk about eating, I think that's one of the things that can reduce toxicity to the artery wall. And I think eating becomes very important.
So, regarding eating, there have been so many regimes and diets, from super low fat like Dean Ornish to the Atkins diet, the Mediterranean, paleo now, and keto, high fat. Is there, just in your opinion, one of those many that are being bandied around style that is the best?
So my opinion on diet is about finding out why that person has deficiencies and then helping them out with that. It might lead to a Mediterranean diet. It might lead to a keto diet. It might lead to whatever diet, but I don't really like the word diet per se. And so I think why they all work and why everyone has success stories behind the diet is because they're doing three important things. Actually four if you want to take it. So I'll go through the four. So number one, there's not much sugar in the diet. Number two, you're eliminating processed foods. So anything that you have to pick up and it's advertising to lower cholesterol or lower sodium or, no sugar, or, if you got to advertise that stuff, you got to stay away from it. And so then it takes me to 3 and 4, which takes me to what I always say, and I think it's one of my first lines in my book on that chapter, is if anything has to advertise to you, stay away from it. Because I never see the vegetables or the fruits advertised to you. So that would be my 4 there, I would say.
So, you already mentioned it, but I'll just recap it. For decades, the notion of cholesterol as being the villain was kind of put forth. Drugs made billions of dollars just lowering that. For decades, the notion of fats was, fat is evil. Well, in the past decade, maybe even decade and a half, we know that is not the case. This is not the case. Can you talk a little bit about that?
Okay, so what happened was, and I'll jump back onto the diet side of things because I think that's super important. In the 80s, when Dean Ornish was prevalent, Dr. Esselstyn was prevalent, I think why they were so successful is you're taking a North American diet and you're giving them a lot more vegetables. So you're going to get success out of that. Many diets will get success out of it. But so what happened I think it was in the 70s, they cut open a diseased artery. And inside the artery, they found 2 things. One was cholesterol and 2 was fat. And so that's where the diet fad came into play, is stay away from cholesterol, stay away from fat. It's going to cause heart disease. We're seeing an exponential rise now, more than ever, of heart disease. It's nothing to do with that. And so as I said, the common misconception is people think that cholesterol accumulates to this pipe, and you have a last cheeseburger and fries, and you end up with a heart attack. And it doesn't happen that way. Cholesterol is an innocent bystander that gets used up into a negative way. Now, I think it's important that, when you come to a clinic like ours and people ask us, well, what do you do differently? Well, we look at the artery like a muscle, not a pipe. And so that becomes important. But then looking at the biomarkers that can be putting you at increased risk of heart disease, inflammation, particle sizes, atherogenic particles that can sliver into the lining of the artery wall. So I'm going to come back to the artery wall here and explain this. So number one, I dislike the fact that physicians lean on cholesterol as a cure, lowering cholesterol as a cure for heart disease. It's wrong. It's false. We're seeing it, the data, all over and over again. What I mean by the data, so the number needed to treat, you're going to see benefits of people lowering because it has an inflammatory cascade that is actually beneficial to the artery wall. So we're seeing some benefits there, but it's not about cholesterol. And if it was, then if we wiped cholesterol off the table, because now we've got statin drugs, it's been around for a long time. That's where we never used to test cholesterol until the 80s, I think, if I'm not mistaken. Now, I was a young kid at the time, so I don't remember the whole situation. But the point is that in the 80s, and then it all became about cholesterol testing. What's your cholesterol? What's your cholesterol? Is it high? Is it high? Because we got to lower it. We got to lower it. Diamond, your dad had a heart attack at 30 years old. We got to make sure your cholesterol is good. Cholesterol. Hey, maybe we should even give you a statin to lower your cholesterol now so you don't have to worry about it. Well, the number needed to treat, how many people need to be taking that cholesterol lowering drug to prevent one heart attack or stroke on a primary prevention is over 100, meaning that 100 people need to be walking into the doctor's office to prevent one heart attack or stroke. Those odds are horrible. And why would I take a medication that could have a number needed to harm as well? It can harm myself, it can harm my liver, increase risk of perhaps diabetes, cause some other issues with brain function. Why would I take something for the risk benefit is not there? Now, the risk benefit starts to benefit those people who have coronary artery disease. But even then the number needed to treat hits in the 30s. And so what I mean by that is 30 people need to be walking into a doctor's office for one person to benefit. It's like walking to a roulette table and hoping you hit one of those numbers. I don't like those odds either. And so it's not about cholesterol anymore. And we know that. It's about the inflammatory cascade that happens and cholesterol, making sure that atherogenic particles get minimized. Because let's talk about cholesterol for a second. I could talk an hour on this, and I do, but I'll keep it simple. You have the good, the bad, and the ugly. That's what we've been told. The good is not all that good. The bad is not all that bad. And the ugly is just ugly. So think about them as buckets, and you have different particle sizes in there. And then you got other lipoproteins that can cause damage, not cause damage, but can get used up in a negative way. So it's like a sliver. So again, inside the artery wall is all skin. If that skin gets damaged, then it leaves it susceptible for those smaller atherogenic particles to sliver into the lining of the artery wall. It's not done there. So Adiel, what happens next is that particle, just like a sliver, if you have a sliver on your hand and it goes inside your hand, everyone's had that before, and you're not able to poke it out because you can't do that inside an artery, your body breaks it down. So a lot of times your body breaks down that particle or oxidizes it. So you get oxidized particles that can also then bring back into the bloodstream and never cause any problems. But once that oxidized particle goes into once it is trapped in there, and how it gets trapped in there is now you get an immune response that happens where these white blood cells come in and Pac-Man all that cellular debris up. Then it goes through an inflammatory cascade, like 40 different biochemical reactions happen. And that's what we look at in our clinics to be able to basically go through those reactions to build up like a pimple would on your face. So it builds up inside the lining of the artery wall. And that's how artery disease happens. And so it's not about cholesterol anymore. I've got enough studies and literature and background, and we've got PCSK9 inhibitors where we can really lower cholesterol. There's a certain class of people that might have to focus on cholesterol because it's too elevated, but gosh, 90+% of the people don't need to worry about it.
Well, I think to a certain extent, cholesterol is needed by the body. I mean, but anyway, we can talk about that, and I want to jump straight to a therapy mode that you use in your clinics, and that is ECP. Can you explain what ECP therapy is and what the benefits are?
Yeah, so external counterpulsation is one of our treatment options to help people, even prevent a high risk or even reverse disease process. So now that all of you are smart and you understand the plaque, how a plaque builds up inside the lining of the artery wall, some people are walking around. So let me take a step back here. So external counterpulsation therapy is one of the treatments we offer in our clinics there's these caps that grow on the calves, the thighs, and the buttocks, and it pumps blood back up to the heart when the heart is in a relaxed state. So you get a bunch of blood flow coming back to the heart. So when the heart's ready to contract again, it then pushes a greater volume of blood out to the whole body. And what it does is three specific things. Number one, it grows new arteries. It's called angiogenesis. Number two, it improves artery function because these arteries are a muscle, not a pipe. And if you don't believe me, you can feel them. You can feel them in the neck. You can feel them in the wrist. You can feel these arteries expand and contract. And if I attached all your arteries together, it would go around the world probably 3 times. Like, that's how many arteries you have. And all of them expand and contract. And so when they expand and contract, especially the ones of the heart, we are now able to improve the artery function, which is huge. And then for those people who have heart failure, we're able to improve heart function as well. So that's the premise behind doing the treatment. But I'm going to take a step back and say, when should we consider this treatment? I think it's important to understand now. There was a trial that came out before COVID, and it showed that basically surgery for blocked arteries is often unwarranted, and that medical therapy, which we just talked about, the number needed to treat, might be as beneficial versus doing a stent or a bypass surgery.
Well, going back to how you explain what ECP does. So again, I'm asking like a layperson, but my aim on this show is to make everything accessible to our viewers, at every level, what you can do. So going back, I assume that the sleeves are synchronized with your heartbeat.
Yes,
so when the heart pumps out, it does, and then it relaxes, and then the sleeve goes and pumps the blood back up, right? Is that?
Yeah. So let's talk about the cardiac cycle for a moment.
Right.
So what happens is you have 4 chambers of the heart. Okay. So you got the top chambers, the bottom chambers of the heart. So the top chambers are called the atria, and you could Google this on anything. You can be able to see the anatomy of a heart. So the top chambers are smaller. The bottom chambers are responsible for pushing the blood out. It kind of works in a different way, but it pushes the blood out for then the arteries to take over to deliver the blood to where they need to go to. So the ventricles are a bigger chamber. So one ventricle is responsible for delivering blood flow to the lungs to get reoxygenated, and the other ventricle is responsible for pushing out the fresh oxygenated blood outside the whole body. And so you have these vessels, so that the aorta, and you have the superior and inferior vena, the inferior vena cava. So what happens is that the heart contracts and then it recoils back ready to fill. So imagine that's happening on this side. So I'm lying on a bed, the heart is pumping. Now, what the cuffs are doing is the opposite of the heartbeat. So basically what's happening is that the cuffs contract when the heart is in a relaxed state.
Mm-hmm.
And then the heart beats, and then the cuffs deflate. So it acts like an auxiliary heart going back and forth. And the back and forth and lying on this bed, you're lying on this bed for 45 minutes to an hour. The compound effect of doing this treatment for an hour is where we start to see the benefits. And then more importantly, the compound effect of doing this treatment over weeks is where we start to see the growing of new arteries. So that's angiogenesis, improving the artery function and growing new arteries. And so I talked about earlier how artery disease happens, how inside it builds up like a pimple on your face. I don't have one today to show you, but that pimple on your face it could be vulnerable to pop open. So what we want to do is strengthen the skin over that pimple, shrink the lipid-rich necrotic core by understanding what nutrients are deficient or where the deficiencies are with you in terms of that plaque or inflammation, and then allow the artery to function more like a muscle at that junction. So we get better blood flow, we grow new arteries, and we improve that heart function. And that's where we start to see the benefits of external counterpulsation.
Stay tuned for part 2 of this interview. Thank you for joining us today. I know you love what's coming next in part 2. Be sure to click the subscribe button for more videos.